Dr. Paul Yonga, we have Dr. Mercy Mwangangi and Professor Omwanzala. And before we went for the break, Professor Omwanzala, you're responding to a question by a gentleman who was talking about how dangerous this is, and you're also responding to this virus being engineered in the lab.
Yes, those are the myths that we totally want to put aside. One, this virus was not engineered in the lab. What we know is that coronaviruses do exist in the environment. We have 4 corona human viruses that cause common cold. They are common. They are the second most common causes of respiratory infection. Then we have a lot of animals that carry their own coronaviruses. Bats carry coronavirus, camels carry coronaviruses, snakes do carry coronaviruses. So coronaviruses are not new, and this particular one has not been engineered in the lab at all. It was a spillover from an animal to a human.
So, Professor, why is it called COVID-19? Where's the 19 coming from?
The 19 is because of the year. I think WHO really didn't want to call it Wuhan. You remember Spanish flu, all right? Then you remember we have called viruses according to the various names. We have called Marburg.
Oh, and Donald Trump has called it the Chinese
Marburg
virus.
is actually a town in Germany. So they wanted to avoid that because it then stigmatizes the disease, and hence the word COVID. COVID is a disease, and the virus is severe acute respiratory coronavirus 2.
All right.
Yes.
All right, thank you. Let's now go straight to your social media feedback, questions that you've asked us, and we will go to our Twitter page and we'll read one of the questions that you've asked. Psycho MF Clown, an interesting name there, says, what drugs are the patients being given to those already confirmed positive? That's the first part of the question. Is the public supposed to know what they're being treated with? I think I'll throw this straight to Dr. Mercy Mwangangi.
Right, so we've emphasized today, so far the patients who are coming in at Mbagathi are being managed according to a treatment protocol that's developed by the Ministry of Health. And so far, I wouldn't call any drug set that we are giving these patients. Usually, these patients would present either with mild symptoms or moderate symptoms of a pneumonia. So we are managing them as you would manage such a case of viral pneumonia. There are no drugs that we are administering to these patients right now. And like we mentioned earlier, WHO is conducting clinical trials that will determine if the drugs that are being mentioned, the chloroquines, hydroxychloroquines, the Kaletra, if these drugs actually have an effect. But so far, for our patients in the country who are stable, are on supportive treatment, supportive management treatment for any other viral pneumonia as you would have.
Well, Professor Rodney Adam, I think I'll throw this at you. And this is also coming from our Twitter feed. And this person, this lady is actually asking, this is Wairimo Caroline. She was asking, if one recovers, can you be reinfected?
That's a great question. And we need more data and more time to find out, because we know that people who recover eliminate the virus. So at least for the short term, they are protected. But how long? Is it weeks or months or years? And what we're all hoping is that it's going to be years, because that means that vaccine development may truly have a chance for helping to prevent this infection in the future.
Well, Anzala, Professor, this one is for you, and this one comes from Omido Joe, who's asking, as Africans, we often share food from one plate and eat with our hands from the plates. This is very common in bars and restaurants, although the government has said they must be closed. Talk of nyama choma, tumbukiza, boilo, etc. How safe is this?
Actually, what was said today is exactly what we wanted to hear. We have escalated the social distancing, and those are the things that should stop immediately. You heard the minister say that the restaurants that are going to open will only open for takeaway, because we know that touching food when you have not washed your hands very well, and you are coughing on your hands and doing all these things, this is the way this virus is actually transmitted. So the measures we are putting in place now are actually measures to stop those areas of where food, touching of not washing very well can be able to transmit, and hence ensuring that you only engage in takeaway where you can go home and share food with your loved ones, but not in social places where we crowd and we go around with all these tumbukizas and sharing all this that is likely to assist in the transmission of this virus.
Well, very many thanks, Professor, and I think that's where we have to wind up. We have run out of time. I wish we could go on this. I'm sure we'll try and invite you again. We just conclude this, if there will be any conclusion, because there's still so many questions that Kenyans have. But many thanks for finding your time to just join us here in studio. We were with Professor Rodney Adam, who is an infectious disease specialist from the Aga Khan University Hospital. Also, Dr. Paul Yonga, who's the youngest in the panel, an infectious disease travel medicine specialist. We also had Professor Omwanzala, who's just spoken lastly here, Professor of Virology and Immunology, Kavi Institute of Clinical Research, University of Nairobi, and last but not least, the only lady on the panel, Dr. Mercy Mwangangi, Chief Administrative Secretary, Ministry of Health. Ladies and gentlemen, thank you so much for your time. Viewers, thank you so much for the questions that you have been sending. Let's keep this conversation going. Stay safe, stay at home, like what the government is saying, and just be there to watch each other's back. My name is Dennis Sokari. That's all the time we had. Good night and enjoy the rest of your viewing, and have a great week ahead of you.